You go to the grocery store, everything has a price tag. At the pump, you know how much a gallon of gas will cost.
But when you go to the hospital, a new report shows, despite federal price transparency law, it can still be difficult to know how much that visit will cost.
On your side, Ashley Reynolds reviewed the 120-page report that tells how our Springfield hospitals fared. Ashley?
Well, the report by patientrightsadvocate.org found that just 22% of hospitals in Missouri are fully complying with the hospital price transparency rule. It's up to you, the patient, to figure out your cost for care.
I'm okay.
Yeah.
I have my moments.
Ariana Russell just found out she has stage 3 breast cancer.
I do 4 months of chemotherapy followed by a double mastectomy to remove both breasts, and followed by 7 weeks of radiation.
She was diagnosed a few weeks ago and has not received one bill yet, but knows she can get an idea of the cost on hospital websites.
Why wouldn't you be transparent?
The new report by patientrightsadvocate.org found Cox Health compliant. Mercy, at the time of the report, was found non-compliant. The explanation reads, fails to provide an adequate amount of discounted cash prices, de-identified minimum, maximum, and negotiated rates.
So they're missing a lot of data that would allow for anyone to be able to truly price care.
That's Cynthia Fisher. She's the founder and chairman of patientrightsadvocate.org and says patients must demand transparency.
None of us would tolerate that at the gas tank. And yet, because we don't see all of these prices or know there's this price variation, we have no idea it's happening every day.
I think because it empowers patients. Price transparency gives patients information they need to budget. It gives patients information they need to, shop around, be able to save sometimes thousands of dollars. I've seen if one hospital in a network of hospitals is out of compliance, usually the whole network is out of compliance. So independent hospitals tend to do a lot better because they only have 1 or 2 hospitals. And so if they provide that information, it's one and done.
As you can see, since early last week, On Your Side reached out to Cox Health multiple times asking for an interview, and we never heard back. I did hear back from Mercy about being listed as non-compliant. A spokesperson sent us this statement saying, Centers for Medicare and Medicaid Services determines hospitals' compliance with these regulations, not political groups. We stand by our transparency efforts, which are supported by the fact we have twice acted quickly to correct requests raised by CMS. CMS has already reviewed our website in 2024 and asked for a minor modification, which we gladly updated.
Are you a political group?
We are a nonprofit, nonpartisan, charitable organization that is truly focused on one simple thing, and that's getting prices in healthcare for everyone.
The takeaway is that it's still really hard to find price transparency information, but I think patients would be surprised by how much is out there now that there are rules in place.
Is the burden still on the consumer to find out how much this is going to cost?
Unfortunately, yes.
Cancer kicks your butt and doesn't wait.